we're seeing the same results because we know these things already. And I think I often have a really difficult time with that we know what the problems are, and the money's not being well spent in areas for things like policy change or going to communities directly or different types of investments. And I think for me, that's really where, like I said, it's a hard conversation because I think research is so important and it's something I've participated in throughout my career. But I think at the end, if we get all of that information, we share it with communities, we learn, and then we just move on, it's really, like I said, a disservice to continuously research things that we know are problems. We know that they need to be addressed in order to solve, eventually reach health equity.
Hey friends, welcome to Public Health Careers. I'm Omari Richards, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Shanaz Chery. Shanaz is Director of Population Health at Greater New York Hospital Association, where she leads various population health initiatives. She has spent almost a decade working on issues like health communication, social drivers of health, disparities, equity, technology, and social justice. She is driven by a commitment to make a positive impact on public health and advocating for healthier communities. She conferred a Bachelor's of Science in Public Health at Brooklyn College, a Master of Science in Public Health Communication for Social Change at CUNY Graduate School of Public Health and Health Policy. In today's episode, you'll hear and learn more about how empowering communities is essential in public health and their needs and perspectives should be incorporated into interventions, why clear, concise, and consistent messaging is crucial in public health communication, how internship experiences and hand-on community work can provide valuable insights and shape career paths in public health, why taking your time to work in the field before pursuing a master's degree to gain experience and figuring out your career path can be helpful, and how building relationships and connections is crucial in the field of public health, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey, this is Shanaz Chery. I am a public health millennial, and you are listening to Public Health Careers.
Hi, Shanaz. Welcome to the show. Always a pleasure to have another Trinity in public health on the show.
Thanks for having me.
Yeah, my pleasure. As well as we were saying before, you're the first person to say that you're a public health millennial. So, woo! Love it. So jumping into everything, like, how do you identify, and tell us a little about your personal background?
Sure. Yeah. For this conversation, you can just call me Shanaz. Pronouns are she, her. I identify as a millennial, of course, like I mentioned in the introduction. I currently live in Brooklyn, New York. So a lot of what I'll be talking about is specific to this region. I live in Brooklyn with my husband, and just really excited to be here and look forward to contributing. I frequently listen to this podcast myself, and so it's a real honor to be a guest on here.
That's always great to hear that kind of feedback. So I appreciate that. And fun fact for anyone that's listening, I was actually born in Brooklyn, New York. So shout out to the Brooklyn posse out there.
We love that.
Yeah. And I guess to that point, so you have immigrated from Trinidad to the US when you were 8. Can you share more about how that has shaped and influenced your commitment to public health?
Sure. Yeah. I love mentioning this. It's such an important part of my story and a part of a lot of the things I'll be talking about today. It really is the root of my approach to public health, my approach to community work. I moved to the States when I was 8 with my parents. So it was just the four of us, my mom, dad, and my sister. We didn't know anyone in New York. My dad picked New York State as a very immigrant friendly state, and not to get too much in the weeds there, but it was a place that he found that we could really grow and like many other people come to the United States for education and really a place to put down our own roots. So in Trinidad, as many may know on this, who are listening, it's a country with developed resources and different types of services. There's a universal healthcare system out there. And I grew up, right?
Somewhat.
Somewhat healthcare system out there. But nonetheless, I think growing up, health, nutrition, food, different types of resources and services, at least in my family, were really important and really large parts of conversations. There was a lot of holistic wellness and different types of approaches to uh, addressing different health needs. But truly, my love for health came from my love for food and culture and all of the things. And so my initial path in public health was around nutrition and just wellness overall. And so I started first on the track of focusing on food. And then as time went on, really branched out more to really all things, because, as you'll hear today and as you've heard from other guests, all things are public health related. And it's just a really fascinating field. And it's really been a pleasure to work with all the people that I've worked with.
What's your favorite Trinidadian food?
Oh, that's a tough one. There's so many good there's so many good foods. I mean, the obvious is doubles, right? I think
Yes.
doubles, anything roti, curry duck, um, not duck curry, curry duck for any of my Guyanese peers that are out there. Um, no, I think any and all things, and on the idea of food as well. Sometimes our food isn't always the healthiest, right? So it's an interesting conversation even around cultural foods too that we've had to have. So yeah, all things. It's there's so much of it, and in New York City, it's you go to Queens and you're just like in the center of it. Queens or in Flatbush, Brooklyn.
Yeah, absolutely jealous because I definitely cannot get doubles or roti anywhere where I am in North Carolina. So maybe if someone's listening to this, they can fix that and start opening a restaurant here. But I definitely think there is a lot of that connection of like food and then health, and then how has food changed and how has that affected our health? Because I think oftentimes about in Trinidad, like just the amount of sugary drinks, like soft drinks that people drink,
Mhm.
and I feel like it's just shifted more to a Western diet in many ways, but it's not a conversation about the health habits of Trinidadians or not. But I guess getting back to your story and the conversation here, like how can we think about empowering communities through the experiences that you've had, whether that's through immigrating and coming to the U.S. or like through your public health experience? What have been some examples of empowering communities that you can share?
I really like this question because I think at the heart of public health, we at this point we all know this. Communities are at the center of all of the work that we do. They have to be a part of the conversations. They need to be a part of the interventions that are created, and we have to incorporate what we learn from them into future, whether it's things like communication or other things that we work on and put out there for them to consume, essentially. So it's really been important to keep communities at the center of conversations, ask them what they need rather than assume what they need. But also at the end of it, and I think about this especially in research, making sure that the end of research that we give back to communities, we don't only go in and ask questions and get information and leave, but then we make sure there's that full circle connection where we then bring back, um, you know, whether it's the information that we've learned and share it with them, but create steps, to help communities moving forward. Um, I think also to my point about diet, we also have to take into consideration when making decisions around not limiting our advice to the cookie cutter advice, right? So, using Mediterranean diets and all sorts of like standard things that, again, we know are well intended. However, if you tell communities that are set on specific diets or regimens that they now need to go and eat or consume, purchase these things or completely overhaul their fridge, their lives, their diet. Um, it really is not effective at all. If anything, it can cause more harm because people are just discouraged and may not trust advice. So I think those two things are really important, and in my work has been really pivotal, um, especially around my work in Caribbean communities. We had a lot of focus groups, really talking to people, finding out what their lives look like and maybe why they're not making the healthiest choices. And oftentimes people are working multiple jobs, there are language barriers, there are other challenges that are in their way that is the reason why they're not making the healthiest decisions. Um, and I always like to say people don't choose to be unhealthy. There are different circumstances and different things that we have to take into consideration. And I think that's really a way that we can make sure that we're empowering communities is by doing all of those things.
Absolutely agree with that. Everyone wants to live the healthiest life and have access and opportunities to towards the healthiest lives. But I think, as we lead in public health, it is the systems and policies and disinvestments that have caused certain communities to have these marginalizations or health disparities, health inequities. And I think you also bring up a really good point. Well, you brought up a couple good points. One especially on like the research and how does the research that we do with communities get back into the communities and like have them be a part of not only the data collection but the data dissemination and like really controlling the narrative of that data, as well as, yes, we can say like these things are healthy or like you should be eating this or that, but then that kind of like negates maybe some cultural aspects that people have. Because food is very much tied to the culture and where you're from. And I think like we have to really be cognizant of how we are telling people like not to eat this or eat this, and just really thinking about what does that mean for them, as a people and as a culture, in doing this work. So appreciate you raising those up. I was going to ask, so you mentioned the point of like you saw the importance of bringing the research back to the community. Maybe was there an example or something that kind of made that concrete for you? Like that was something that needed to be done or had to be done as part of this work?
I think at all levels, especially when I was just in the academic setting going through my graduate school and even undergrad, you consume so much research. And a lot of the times, especially at this point now in my career, um, the research obviously was there. And I'm at a point where now I'm still seeing research done on things that we know as being matter of fact. They have been researched, money has been invested into them. We know things like housing are important to health. So I think I sometimes really struggle with this because I continue to see money go into research and we're seeing the same results because we know these things already. And I think I often have a really difficult time with that we know what the problems are, and the money's not being well spent in areas for things like policy change or going to communities directly or different types of investments. And I think for me, that's really where, like I said, it's a hard conversation because I think research is so important and it's something I've participated in throughout my career. But I think at the end of the day, if we get all of that information, we share it with communities, we learn, and then we just move on. It's really, like I said, a disservice to continuously research things that we know are problems. We know that they need to be addressed in order to solve and essentially reach health equity.
Yeah, and I think that that's a lot of the pushback that a lot of, I guess, maybe public health practitioners get, is like there isn't enough implementation science that goes into to a lot of the research, or many times we're researching things when we already know that there are issues, and we're kind of like, I don't know, just doing the same thing over, like to your point, doing the same thing over again, but not really doing things to actually impact change.
Mhm.
And to your point, like how do we think about like policies and structures that can really impact change? Like housing, we've known how important housing is as a social determinant of health, and but what has been done, what are the policies and implementation that has been done, it is really lacking. So I appreciate you raising that up as well.
No problem.
And as we learn, as we dive deeper into your experience, you have some experience working in health communication. So thinking about communications for social change, what do we get right and what do we get wrong?
I love this question. um, so public health communications has obviously been around for a very long time, and over time, the method of communication has obviously expanded with technology and some of the other, resources we now have to communicate. I think I'll end on a good note. So I'll start on the thing I think, need to consistently work towards. And that is, I think about the three C's of communication, which is just being clear, concise, and consistent. And I think oftentimes in public health, within all the different sectors, so whether it's through government, community, hospital, individual providers, practitioners, on the national level within the United States, the international level, there's often not consistent messaging across many different topic areas. And we saw this primarily during the COVID-19 pandemic, where um, even within our own, federal agency, there was um, different types of messaging that was circulating around, like mask wearing and vaccines, and this is separate from misinformation and disinformation. This is more around when people turn to reliable resources, they were still seeing gaps in information across different, quote, reliable resources, or what should be reliable resources. Um, and I saw this when I even spoke with people, and they said through this one source they saw this, and or even through their local officials heard this or were advised to do this, and then individuals that lived in other states were advised to do this. And so even within our country, we saw that there was division, and not even to factor in the political role things played too, but layered with that, even at the very basic communication, even around food, are fats good, are fats bad? Should we drink alcohol? Should we not? Is cannabis bad? Is cannabis good? Is it beneficial? There, all these conversations where I think we also, in public health, if we don't know, we should say, we don't know yet, and we're continuing to research, and that should be consistent across, again, all levels, because communities need that. They need to be able to see that even within our internal agencies and all of the different sectors that we work in, that we are consistent and we're telling them information that we know to be true, and we're being, clear as well on that information.
Absolutely love that, and I think that that's an important point, and especially like I think it's a good case study looking back at like the pandemic and communication throughout the pandemic, and what went well, what didn't go so well, and how can we really like ensure that we are having effective communication. And I think like to that point of how do we create avenues to say, hey, we're not sure right now, but we are collecting the data, we will let you all know, and like have those trusting relationships with those communities or maybe community leaders to really let them like understand and advocate and try to like, I don't know, just see like eye to eye on the communication things. But it is definitely challenging, but definitely appreciate those insights. And I guess jumping on into the next question, like what does public health mean to you?
Oh, I didn't get to give you a positive.
Oh yeah,
If
before we
you
move on, please, positive.
positive as far as communications is, I think that we are really paying attention to our audience. We are finding creative and effective ways to reach people, whether that be making sure information is translated to into different languages and shared, whether it's printed or online, or many agencies are utilizing technologies like WhatsApp to share information, and different types of platforms. And so I think we're really getting creative using all of our resources, and getting messages out there to people that really would benefit from them. Um, and I think about even in New York City, the city health department has found really creative ways to um, make you do a double take of their advertisements and their promotions. Like right now, they're running something on sexual health awareness, and in the ad, there's a banana and like a condom featured. Really these types of things that kind of make you do a double take and say, well, what's really like, oh, I see what they're trying to do here. But that's really what gets people's attention, and it makes people look, and they're using techniques that we often see companies and sort of the business strategy use, right? Sex sells, and so we're using sex to promote healthy sexual habits, and so that's really what I think we're doing well, and I hope to continue to see us expand on that type of approach.
Definitely need to up our marketing and create ways to get engaging. I feel like especially going forward, it is so challenging with everyone and everything marketing towards people. It's like, how do
Mhm.
we as health professionals get in front of people and communicate these important messages in ways that like get them to, as you said, get a double take and then look back. Um, but yeah, what does public health mean to you?
Yeah, I alluded to this earlier in our conversation. Public health started as a small focus on my health and my immediate community's health, and over time, it's really expanded into not just health as far as health outcomes or clinical outcomes, but it's expanded into things like longevity. How long are we living, and then quality. What types of are we living full, happy, healthy lives? And those are two things I think about often, because aside from just those health metrics, we're focused now on things like mental health and really making sure that not only is someone physically healthy, but their day to day they're feeling contentment or joy or not, in a situation where their overall health is being affected in a negative way. So public health, I think, has expanded beyond just um, health measures and health outcomes specifically, but more broadly as like a holistic approach. And then, you know, I look at everything and I see public health. I feel like I can argue that anything is a health concern. In New York State, we just went through a couple of heat waves, and even that was a public health concern. And it's just everywhere. It's ingrained into every part of our life, and I'm very proud and of myself, and I have a lot of peers that now, as we walk through life, we view everything through this public health lens, and it's really fascinating. And I'm sure you have this as well, where you almost can't unsee, like you make these connections day to day, and it's really I think a very equitable, honest, and empathetic way to live, because you have the ability to connect with people and see things from different perspectives.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at phmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. The public health lens, I think, is a blessing,
Hmm.
and really does allow you to like really dissect all the things around us and say, okay, like how does that point back to being healthy or being unhealthy, and like what are the programs, structures, systems that are set up around that certain thing. So, absolutely agree with that. So you began your studies at CUNY Borough of Manhattan Community College and then transferred across to get your Bachelor's of Science in Public Health at Brooklyn College. Can you tell us about that thought process and walk us through those years?
Sure. Yeah, I started at community college. Um, Again, this is all in New York. In my community college was in Manhattan, but I've lived in Brooklyn since migrating to the U.S. Um, the community college track was not the first track that I had, but there was a lot of challenges, of course, when you're initially undocumented and navigating different systems. And so that was a path that I um, found that was helpful to me to then find my way into a 4 year institution. So that's initially why I went there. But I was really grateful that I started there, because um, I had a lot of fundamental courses and like health 101s and things like that, which continued to plant that seed that public health was where I wanted to be. And so then after I believe it was a year at community college, I transferred over into Brooklyn College, which was a 4-year institution. And at the time, I was still on the dietitian nutritionist track. They had a program specifically for that, and my ultimate goal was to become a registered dietitian. But I believe my sophomore or junior year, they started to offer public health at the undergraduate level, and I looked into it, and I found that nutrition was going to, I felt like maybe be a little too narrow for me, and I wanted to expand my options a little bit further. And so I looked into the public health track and switched over. And since then, just yeah, public health has just been the space that I've operated in, and thankfully, I can also revisit my interest in food and nutrition because of the link there.
And that's also the beautiful thing about, I think, like public health in itself is like whatever your interest is, there's typically a way to kind of pull that into your work as a public health professional or your lens as a public health professional. So and I think like to that point it's so important to have people in public health who come from different perspectives and are able to share those perspectives, because that helps us have like more robust solutions and programs and whatnot. So appreciate you sharing that. While you were in Brooklyn College, you were a research associate. I believe this was an internship. Tell us about that experience.
Yeah, this is actually connecting back to some of my earlier comments about working with communities. This is really where I got to have that firsthand experience. So this internship was with a professor on campus, and we were just a small research team that was developed of focusing on Caribbean health and the immigrant experience as well. So what happens to people as they move from the Caribbean into the United States, as specifically around their health. And so we looked at Jamaican immigrants, and then we looked at West African Ghanaian immigrants. And really we're finding that, I think you had mentioned this too, where many parts of the world have become so globalized that they're consuming things like cereals and sodas and things that are typically Western, even in those parts of the world. But in the internship, we set up a couple of focus groups and wanted to hear about specifically their different types of eating routines, what their diets consisted of, what their day to day looked like, all things that were affecting their health, and specifically increasing their risk for type 2 diabetes. So there was really there was a lot of interesting things and things I've even seen just anecdotally within my family, where individuals may be on a healthy BMI level, scale, and appear healthy, but still are, because of other factors, are at high risk for diabetes. And so there was some really interesting things that came out of that. But really the core thing, this is where I learned the importance of talking to people in communities, finding out what's going on. And then a lot of the research that we did and went on to present on, and the lead principal investigator went on to publish. We came back to the communities and we told them, we shared the findings. There were resources that were provided to them. And I believe to this day, I know I still participate in, there's an advisory group that I still participate in to oversee future projects that they're working on. But those connections have remained within that work.
That's awesome, and I think it's like so important that you're highlighting that as an undergrad student, being able to like dive into this internship experience where you're getting hands-on experience doing focus groups in community with people, communicating with people, and I wish I had this kind of like experiences during my undergrad, because all of my experiences were either, I guess, healthcare kind of volunteer type of setting or microbiology type of setting, but nothing where I was like interacting with people in community. So I think like that is like so valuable, especially as you're coming into public health, to get that hands on the ground kind of experience there. And before we move on to after undergrad, were there any takeaways that you wanted to share?
From the internship?
Internship or just like entire undergrad experience?
Yeah, I think um, my main takeaway would be I know there's a lot of pressure. I'm thinking of individuals who might be, if not already in undergrad or in undergrad and trying to figure out their next step. Um, I think, as you've heard from my path, I started in one place and ended up somewhere a little bit different. Sometimes people know exactly what they want to do and go on to pursue a master's in it. Sometimes people don't, and that's totally fine. And I think that's my biggest takeaway is the way that I was able to narrow that down was being involved in things like internships, talking to people um, on campus, talking to my professors, and then finding out sort of what the long term path could look like. And I think that I would encourage people at any point, if you're even having a career change or anything going on in your life, that you just stay open to all the opportunities and soak it up, and it will lead you to the next thing that's right for you.
That's a great point as well, because a lot of people come into public health not really know where they want to go, and I think it is up to the experiences and the conversation that you're having with people, as well as using LinkedIn and other resources to just kind of figure out what is it that I like, what is like the career trajectory for someone doing this kind of work, and how can I do that kind of work or get experience so I can be a strong candidate for those types of roles after graduation. So that's awesome. After undergrad, you decided to get a Master's of Science in Public Health Communication for Social Change at CUNY Graduate School of Public Health and Health Policy. Can you tell us about that? It is. It is. Can you tell us about that thought process and maybe even like, okay, so because you said you went into undergrad as a nutrition, dietetics interest, then you were taking some health classes, switched over to public health as your school had that major. You were able to do this research, internship and like work with the community. You graduated. Did you know that you wanted to do a master's degree? Why Masters of Science in Public Health? Were you thinking a Masters of Public Health? Yeah, so tell us about all of that.
Sure. Yeah. In public health, at least in New York City, New York State, you almost always need a master's. At least from all the jobs that I had seen, I remember when I was looking, when I was in undergrad and sort of thinking about my long term career. So a master's was almost guaranteed. There wasn't a question about it. I took 6 months or so in between undergrad and my master's. So I sort of, pretty much immediately went into it. There wasn't a huge gap. Um, I'm noticing that there's a trend here in my path. But when I started at CUNY graduate school, I was on the community health track. So this was there was only a couple of tracks, and community health seemed to most closely align with what I was already doing and was focused on community based work and that type of approach to public health. Some of the other tracks were more epi biostats, health policy and management, but and I believe environmental science. But the community health was the track that I found myself perfectly sort of aligned with my long term goals. But then similarly, a few months into my master's program, which luckily at the very beginning you're doing a lot of the core classes, so a lot of things were similar across all of the different concentrations. There was a new program, the Masters of Science for Public Health Communications and Social Change, that was introduced. It was it's so funny. The web page wasn't even up yet, wasn't even completed when I saw it, but it was posted. I saw it. There was an email for a professor on there. I reached out and I was like, "Hey, what is this thing? I'd like to learn more about it." And then yeah, I went from the community health track into communications because I thought it was such a unique and different type of role where communicating is such a big part of public health. It's really fundamental and core to everything that we do, whether it's in the, whether you're doing community health education or you're writing papers for publication. There's a fundamental level of health education that health communication that has to take place to be able to really make meaningful change. So that's really where I found that track. And um, I also was rebelling a little bit from all of the MPHs, because also in my region, MPHs have become very popular, very trendy. And not that they're still not valuable, of course they are, but I thought that this was kind of positioning me a little bit more on a applied sciences a little bit, because I had all of this. My bachelor's was in public health, and I thought, okay, let me do a master's in something slightly different, just to round out my knowledge and education. And so, yeah, that's essentially why I went that path. And I think also it was all new information. I felt like I oftentimes, I know graduate programs build on a lot of the basics that we learn through undergraduate programs, but I found that a lot of the information was, some of it of course was fundamental things that we've learned and built on that, but there were also whole new concepts and things that I use to this day in my work.
I love that, I'm glad that you're able to talk to like that transition of thinking about like community health work and then switching across this communications, and like why that was a big part for you, as well as like looking at the landscape of where you wanted to work, where you wanted to live in New York, and saying, okay, everyone has a master's, everyone also has a master's of public health, I already have a bachelor's of public health, let me think about like how are things that I can like differentiate myself and maybe build skill sets that other people do not necessarily have. So love that perspective, and I think that's a good framework for other people as they're thinking through like what do I get my master's in, or like how do I think about where I want to end up in the field. So that's good. And did you have any experiences during your graduate program that you wanted to talk about?
My graduate program was fully online, so that was a very unique experience, I think. And this was not because of the pandemic. It was structured to be a fully online program. So I think that was just a unique experience overall, just navigating, because I was working full time. So the program was great because it offered that flexibility, but it really was important to build. I mentioned earlier in my undergraduate experience, building relationships with professors and talking to people was important to networking and figuring out, my career path. When you're fully online, it's a little bit it's more difficult to do that. So my real takeaways was, like you said, really utilizing technology and tools to get on Zoom calls with people and reach out on LinkedIn and make sure that even in the virtual setting, you are learning from others and finding ways to grow your network.
That's real. That's probably one of the biggest challenges I hear from people in like online programs, is just you having to be like that more intentional in setting up time to connect with professors or cohort members and different things like that. So I appreciate you sharing that as well. And I think like it's also a good conversation to have, like, because you're working full time while going to school, which I think is something that a lot of people are also considering. And like what was like that experience like for you? Was that difficult to balance, or were you able to handle that pretty easily?
There were times it's challenging, but I think it's really important to be working, at least if you finish undergrad and then you're thinking about doing a master's. I always encourage people to take some time to work in the field, not only just to gain the experience, but it will help you figure out where you want to go before you invest time and money and different types of resources into pursuing an entire degree. Um, and then again, speaking for New York, uh, if everyone has a master's, everyone's, obtaining higher education, how do you then differentiate yourself? And that really is about work experience. I don't think I've ever gotten a job because I had a master's. I think it was mainly because I had the work experience and, of course, the education to support it. But primarily, the thing that I was able to always leverage was my experience.
Yeah, and I agree with that. And Definitely helpful for people to think through as they are going forward. Because, like, to your point, if you're going to any bigger cities for public health, Atlanta and New York, well, I guess, yeah, city states, Atlanta, New York City, what other place, DC, these places where there are going to be a lot of people with master's degrees. Many times those are just like the, what is it, the gatekeeping tool to get people in, and then it's like, what is the experience, or what are the things on top of that masters that really build you out as a strong candidate? And definitely agree with your point of not rushing to go into a master's program, especially if you have no idea what you want to do. That is nonsensical
Yes.
in my opinion, because it is a huge investment, and especially if you're unable to kind of like find out what you want to do in that time, then it's just even more challenging all around. So definitely get experiences where you at least have an idea of the types of things that interest you, or that you have interest in getting into, and like reach out to people and kind of like hear what they think of the field, and like how they would give you advice to kind of get where they are. Those are the kinds of tips I would give people on that.
Yes, I echo all of those too.
And did you have any master's graduate program takeaways that you wanted to share with us?
I think my only thing would be similar to just making sure you remain connected with the people in your cohort, or um, because oftentimes you don't know where you're going to see your peers again. It's really important to build out those relationships. Um, that's something that I think we when you're working and you're going to school and you're really just trying to keep up with everything, it just seems like another thing that you have to worry about. But truly, I can't tell you how much I've come across someone, whether I go to a conference or I'm trying to reach out to another organization, and I notice that, oh, this person that I went to school with like works here, or I see someone somewhere, because I feel like everyone says this about their field, but public health can be a really small field too, right? You start to just know people, and especially within certain agencies, we build these networks within this environment. So it's really important, and I definitely see and understand it can be difficult, but try to be strategic and mindful, and also think about mentors and other ways that you can be connected to people.
Yeah, you definitely never know where someone is going to end up and how that could be helpful to you. So keep those relationships and connections alive, that's for sure. So you graduated from your master's program. You might have been working at the New York Department of Health and Mental Hygiene. Was that during your master's program as well, or was that afterwards?
That was the tail end of my undergraduate degree into my master's program. Yes.
Okay. Okay. So you had three positions there. You were a Hope Team Outreach Worker, which I believe was an internship, and then you got moved into research assistant for the World Trade Center Health Registry, and lastly, a chair for the HEP Free NYC Communications Committee. So can you walk us through those positions and kind of what you did in those roles?
Sure. Yeah, the Hope, which now I'm trying to remember, Hope stood for something, and I can't recall right now. But it was
So many acronyms in public health.
so many acronyms. Yeah, so many. My brain has replaced Hope with other acronyms that come up. Um, but it was yes, it was an internship. These were a group of my peers that were students at surrounding New York City colleges as well. Um, and the health department, did this outreach to gather a group of us that were, going to school on campuses to. It really was them thinking about how they could reach college students to educate them about things like, specifically for us, we were focused on viral hepatitis. So, thinking about communications, it's having us be those trusted voices, those leaders to be able to take the information, make it digestible for our peers, and then be, bring them back to our campuses. So, in that work, we went to different high schools, presented on viral hepatitis. So instead of this information coming from, folks that had worked in the field that were disconnected, different generation, different, ages from the people that were providing the information, we were able to share, information just using plain language, slang, and all sorts of different things to make sure that our peers were understanding the public health messaging. So there were, things around using clean needles to prevent, blood from being infected by, blood, or if someone goes to get a piercing, making sure that, again, we're thinking about hygiene and cleanliness, and preventing the spread of viral hepatitis. So it was a really, really cool experience, really grateful for it. But it really was helpful in helping me then move into the research assistant role that I did, which was still at the city health department. It was just within a different department. And through that role, I got to utilize some of those initial research skills that I developed in undergrad, and got to apply it to the World Trade Center Health Registry, which, if people are not familiar, is a longitudinal study of individuals that were impacted by 9/11. So it follows the health of many first responders and other individuals who were within the impacted area. And every couple of years, I forget the exact timeline, they send different surveys out. So there's a wave 1 survey, wave 2, etc. And it's really just trying to see, and follow the environmental impacts of 9/11. So that was really interesting for me to be able to see this not just the small study that I did, but now be a part of this larger study that's ongoing. Is really important. It was such a impactful thing around the world, but also in New York City. It definitely impacted the people that lived here. Even if you weren't in the immediate zone, some of the surrounding neighborhoods were impacted, and people are experiencing health conditions and various health outcomes because of it. But it was a really great experience. I learned a lot. I got to be a part of a research team, and saw the different processes that they went through for publications, and was a part of that work. So that was really important. And at the same time, I was still maintaining my work with the viral hepatitis program. And this is where we built out, through my work, we built out different channels to expand the communication. So it wasn't only reaching people on college campuses or high school campuses, but we started to reach people through, I built out different avenues on social media. So we had, at the time, Twitter, now X, we used to post on there. We had LinkedIn, we used Facebook, and then we created different pamphlets and t-shirts and brochures and resources that we would use when we did different types of health fairs and tabling events. So I was really able to refine a lot of the skills I started in undergrad, and then be able to apply them to these specific content areas.
It's awesome. No, well, thank you for walking us through that. And then after that role, you were a helpline specialist at the American Liver Foundation. So how do you come across this, and what do you do?
This goes back to those important connections. So when I was at the city health department in that communications committee role, the coalition that I was a part of had, if not 50 to 100 community-based organizations and different types of organizations. And the American Liver Foundation was one of those organizations. So I had been in contact with staff from there for some time. And this role became available. I was interested, I reached out, and the role directly connected back to my viral hepatitis work, because for anyone not familiar, viral hepatitis affects the liver organ. And so in this specific role, I worked at the Helpline, which is what it sounds like. It's a call center that people can dial. The number used to be 1-800-GO-LIVER. I'm not sure if it still is, but that's what it is. So anyone can dial that number, and then we would be on the other side of the line. And we did not provide medical information. We couldn't go through people's lab work or anything like that. But they would often call in and say, "Hey, my doctor told me I have fatty liver disease. And then we would be able to say, okay, this is what that means, and this is how these are generally the nutrition, education, wellness like advice that we would give based off of some of the research and standards that we've seen in the field. Um, and so it was a really interesting role where I got to utilize all of those skills, taking really complex health information, giving it back to a consumer, making sure that they understood it, them asking questions, me being able to answer any questions or concerns. While, like I said, staying in the box of knowing we're not giving health information, we're not assessing blood work or anything like that. We're talking about medications, but more so giving them tools and resources so that they can make informed decisions.
You were then the mentor for the New York State Department of Health. Tell us about that experience.
Yes. So actually that has overlapped with my even my role that I'm currently in. Um I have just personally been really interested in continuing to work with students. I know how important that was for me when I first started. And so I've always sought out opportunities to be able to, um, in this case, mentor or provide any sort of advice or talk through career paths and things like that. Um, and so that's something that I came across. I think the state health department was launching a public health fellowship, and they were looking for mentors to help their students, throughout the program. And so I applied for it, was selected, and was then matched with a fellow. And it was really great because I got to learn from them because they were primarily a biostats epi track. And then they got to learn a lot from me just because now I've transitioned, and I think we'll talk about this also, into a health policy, um, even more broadly than just community health sort of track. So yeah, I learned just as much from them as I think they may have learned from me. So it was a really great experience.
Yeah, definitely sounds like a rewarding experience as well.
Yes.
And so you're currently the Director of Population Health at Greater New York Hospital Association. Before you became the director, you started off as the program manager for the Health Information Tool for Empowerment. So let's start off there. Tell us about how you get into that role and what you do in that role.
Sure. Yeah, I'll call it HEIGHT for short because it's an acronym. But I got started. I went from the liver health, the liver foundation, to Greater New York Hospital Association. This was not through a connection. I saw a job posting and I applied, and went through the usual route. The program I worked on specifically, HEIGHT, is an online resource directory. It covers New York City, the 5 boroughs of New York City, Long Island, and Westchester. And it lists resources like food, housing, education, youth services, a variety of services that are free or low cost. And it's a publicly available website. And really, the thing we're very proud of is that it's updated. So it's kept up to date. It's not just a guide or resource book that was created and then unfortunately went out of date after a couple months or weeks or so. But there's over 6,000 resources people can go on. If they're looking for food, they can type in food pantry, they can type in food, they can type in job placement or really anything and find local community resources, state resources, city resources, or even some federal resources that they can then reach out to and get connected.
And then you were promoted to Senior Program Manager of HEIGHT and then Director of HEIGHT. So maybe just walk us through what kind of changed in those progressions in the role before your current role.
Yes. I would say the biggest changes were from more of a day-to-day program management where I was overseeing the database and a small but mighty team. There's two other people that make all of the work happen. Um, instead of the just focusing on day-to-day operations of just keeping the website relevant, doing provider trainings, things like that, doing different demonstrations of the website, I moved more into a strategic role, I would say, where I was more focused on connecting specifically for our work with hospitals, finding out what their needs were, whether or not the tool, which I probably forgot to mention this, it was initially created for um, providers, practitioners who are looking to connect their patients or clients to resources. So through a lot of my work now, it was making sure that we were addressing any of the gaps in the tool. So it went from, again, that day-to-day overseeing of the program to being a little bit more creative, strategic, and building connections outside of the organization.
And in your role as director of population health, can you tell us what those roles kind of what do you do in your role, I should say?
Sure. Yeah, it has continued to expand in the sense of I went from focusing just on access to social services to now I work on a variety of things. So in New York State, New York City, and actually many states across the country, including North Carolina, there is a heavy focus on social services, and we've seen this through certain policy changes. There are Medicaid 1115 waivers
Hmm.
that
Hmm.
allow states to use Medicaid dollars to pay for things like social services. So in North Carolina, it's I believe NC Cares 360 or something
Hmm.
to that effect. Um, so similar, that's really what my work has expanded into now because New York just got approved for their, well, not just, but January of this year, got approved for their Medicaid 1115 waiver, which will do exactly this. It will be a demonstration project that focuses on addressing social needs to affect and produce healthy health outcomes essentially. And so I've gone from the micro level of working on just the resources to now focused on larger things like the policies behind getting social services and supports and the um, different advocacy routes that we can use. Hospitals are also screening patients for social needs. A patient comes in, they'll ask them a series of questions. They'll identify if they need food or housing or anything else. And then they're working with community based organizations to make those connections. And they refer patients to communities to get the resources. So I'm a part of that work within the hospital system now. So um, Height was great because it was a great bridge. It focused on the community. Then it's transitioned more into the hospital space. And then now I've been looking to New York City, New York State, and more the national landscape of how other states have done this too.
Well, that's very exciting. We can, yeah, definitely take the successes and the challenges slash lessons that North Carolina has been going through with this program. But it definitely is very exciting to see like government agency, Medicaid wanna pay for social determinants of health needs, which has not been the case before. So I think there is potential for like huge impact when you're thinking about because the main domains I think here in North Carolina, food, toxic stress, housing, transportation, and there might be one other domain, but it is really cool, and it's also cool on the other side because now there are these community-based organizations that are having a revenue stream that
Mm-hmm.
they're able to generate revenue for delivering these services to community, which many of them probably already were delivering food and doing a lot of these things already. So it really is awesome to see it come full circle, and I hope that these pilots like pick up steam and it becomes a national thing really soon, and it works out in a way that is also equitable. But I think that these are very exciting times for these like big players making these changes.
Agreed. Yeah, and thank you for that point about making sure that these services are funded and community-based organizations are paid. I think that's again to go back to how we make sure things happen and people actually get services is we have to fairly pay for these services and make sure that organizations have staff and capacity to be able to do the really important work. So, yeah, thank you for making that point.
Yeah, absolutely. And I look forward to seeing how that unfolds in New York. I will definitely be paying attention to that. So before I move you on to the Furious Five, I'd like to ask, where can people connect with you, and where would you like to see yourself in the future?
Sure. Yeah. Please, you can find me on LinkedIn. My email contact information or it could be shared. Well, not email, we'll talk about that, but my LinkedIn. Please feel free, anyone listening, to connect with me on there. I love talking to folks. Happy to answer any questions, or even if you're working on something related, I'd love to hear about it. I love learning and connecting with people, so please feel free to reach out to me. Um, as far as next steps for me, I think there's a lot happening in New York. I want to stay just on the front lines of some of that work. But even more importantly, I hope as I continue in my career, I want to continue to expand my level of knowledge and the landscape and see what other parts of the country are doing or work at a national scale as well. So those are all things that I hope I'll have the opportunity to do in the future.
Well, we look forward to seeing that, and excited to see, as I said, how this work unfolds in New York as well, and the role that you're able to play in it too.
Great. Thank you.
Yeah, you're welcome. So moving on to the Furious Five, the five questions that I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Just go for it. Just do it. Just do it. Because I think we've both echoed this, right? Anything that you're interested in, I'm sure that there's a space or a role or a path in public health for you. Um, so I would highly encourage you, just go for it. Also, we need people from different sectors with different backgrounds and different types of approaches in order to be creative and make sure we're getting a fresh set of eyes on all the things we do in public health. So um, highly encourage it, and I think that similarly to my advice about when you're young, it's okay to not know everything that you want to do, but I say it's not going to hurt you if you just look to see if there's a path in public health for you, and I'd highly encourage it. But maybe I'm a little bit biased too, so I don't know.
Number two, if you're wanting to, if you were talking to someone wanting to get in your position, what advice would you give them?
Like I've mentioned earlier, connect with people, make sure you're learning from others, ask questions, similarly listen really intently, and you'll find your path. My path wasn't clear cut, as you've been hearing. I started in one place and ended up in different places, and my work and my career has evolved over time. And I think just be open to that. And yeah, I wish you luck on your journey.
Number three, what's something you're working on improving in your life right now?
Oh, this is so funny and so counter our conversation, but my own health. I am working on improving my own health. I think we spend so much time communicating to patients, clients, communities that health is important and all of these things. And I think oftentimes we're so busy doing the work that we don't give ourselves the same level of care and attention that our own health needs. So yeah, working on making sure I'm eating, I'm drinking lots of water, exercising, doing all the things that we tell people to do.
Love it. Number four, professionally, do you recommend anything?
Yes, but a lot of the things that I consume, books and podcasts and YouTube, are not public health related. I love the podcast Diary of a CEO. It's Steve
Hmm.
Barlett on,
Hmm.
I believe, all streaming platforms. This podcast, of course, has been very helpful, and there's been some really great guests on. So kudos to you for that. Um, I have an interest in public personal finance. So I like to look at a lot of things just related to my own, how to navigate salaries and negotiating for roles and building your career and investing into yourself and your future and things like that. So those are a lot of personal interests that overlap with some professional things, but I would say are not directly public health.
Yeah, definitely things that I feel like we need to be talking, having conversations about earlier in life, as you're developing as a professional and as an adult. But yeah, love those. And if there are any of those podcasts that you do want to share around like finances and stuff, feel free to share those with me, and I'll put them in the show notes for people. But definitely a huge fan of Diary of a CEO.
Oh, awesome.
Yeah, I have his book on my bookshelf that I'm supposed to read, but
Yeah.
I haven't gotten to this yet. Last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Slow down, just a little. I think I hope I'm not being contradictory, but I think everything I've shared about career development and growth uh, has to be intentional, and we work towards it. But at the same time, um, it's okay to take time to figure out your path. It's okay to change your mind about something and go back, and really the goal is that you, and we've both talked about this, be really mindful. It's sometimes these things are huge investments, not only financially but your time, and it's okay to slow down, work, travel, talk to people, um, maybe go off the path a little bit, as far as maybe someone advises you to go this way and then you really feel it in your gut that you should be going down this path instead. um, I think these are all things that I wish I had done more. I was really worried about my career and doing well, and again, my immigrant experience played into a lot of that, right? I wanted to do well. It's part of the goal about moving to the US. But at the same time, I think for our health, mental health, wellness, and just overall everything that we're doing, you'll be a much better person and public health professional if you are intentional about your next steps.
Absolutely. Well, this was a great conversation, great insight. So thank you so much, Shanaz, for coming on and sharing your expertise with us.
I was just gonna say thanks for having me. I feel like I should have talked the whole time like this. I
You
should have
should
do the
have.
whole interview like this. I don't know why I
You
didn't do
should
that
have. You
before.
should have. I don't know why you didn't.
Next time, next time, next time.
We'll have to look back on that.
No,
But
thanks for
housekeeping
having
items, everyone. Yeah, my pleasure. Housekeeping items, everyone. Thank you all so much for watching. So be sure to subscribe if you have not as yet. Leave a like, leave a review, and share it with a friend. Greatly appreciate you all. See you all next week. Peace.
me. Thanks.